you talk all the time, you'll never hear what anybody else has to say. And therefore, all you'll have to talk about is your own conversation. The same is true for people who think all the time. That means, when I use the word think, talking to yourself, subvocal conversation, the constant chit-chat of symbols and images and talk and words inside your skull. Now, if you do that all the time, you'll find that you've nothing to think about except thinking. And just as you have to stop talking to hear what others have to say, you have to stop thinking to find out what life is about.
What's going on, guys? This is your boy Abe. Welcome back to the High Power Lifestyle YouTube channel. And I'm here at my appointment here at the Emory Sports Complex, which is actually where the Atlanta Hawks come for their treatment and training as well. So I'm here to meet with a cardiologist. Again, just a follow-up to see how I can ramp up my training after COVID. Because as I mentioned in one of my previous videos, there are things that you need to know as an athlete after COVID. So after learning those things, I said the smartest thing to do is to book an appointment with a really good cardiologist to get the best advice. So that's exactly what I did. Wanted to bring you guys along with me. I didn't sign a waiver yet, so I can't get you everything, but I'll try to get you what I can. And what I'll do is I'll report, back what I can and the information, that I obtain and things I learn and things like that I can share with you that may benefit you as well.
The force of liberation will blow the world to pieces.
So I'm in the doctor's office. So far, I've just got an EKG done. They took my blood pressure and stuff like that. So everything looks cool. Just waiting for the cardiologist to review everything and come in and, do any additional tests that he may need. I just wrapped up my doctor's visit with Dr. Jonathan Kim here at the Emory Sports and Medicine Complex, and great news, I'm cleared to start running again. I of course have to ramp up with everything, so my EKG and everything came back normal. So he did advise that I slowly ramp up to 2 to 3 miles a day for a few days and then just gradually increase from there. But my heart and everything looked fine, so he was okay with me, just after that, just kind of just going with what felt comfortable. He did also share that post-COVID evaluation is essential if you're an athlete, because as I mentioned in my previous video, myocarditis is a really serious condition that can happen as a result of pretty much any virus, as he explained. But more so with COVID, it is not something to play with. So he did say that also that heart-related symptoms as a result of COVID in athletes are really low, but you still don't want to chance it. So if you feel any way about starting back and you have any questions at all, you want to schedule a visit to the doctor. All right, so other than that, man, the information that he provided was very valuable. You want to get checked, you want to make sure that your heart is in the clear, and all that stuff. And I'm gonna be honest with you, I really, at this point, I feel like it's time to train for the marathon, baby, my second marathon. So the Publix Marathon coming next year, 2023. I'm getting the itch. If you have any questions, seek advice from a healthcare physician first, but definitely ask below. And if there's anything that was covered in my visit that I can share with you, I will. One important piece of information is that the myocarditis that can happen in athletes post-COVID, or any virus for that matter, is very low for athletes who don't have pre-existing heart conditions. So that is one thing that I did learn today. And that was one thing I was really highly worried about. Just be smart about it, grind responsibly. That's one of my messages. Grind responsibly, do what you have to do to get healthy, and get medical advice if there's any questioning at all post-COVID or post any virus, when you're trying to really take your health and your fitness serious. And that's it, man. That's all that I got, man. I got cleared. I'm ready to go. Thank you guys again for watching. Remember to like, share, and subscribe. And as always, keep going higher. Peace.
So myocarditis is inflammation of the heart muscle, typically caused by viral infections, viral invasion of the heart muscle, which leads to intense inflammation. And what we know about myocarditis for the athlete or for anybody who engages in intense levels of exercise are two things. Number one, exercise, when you have active myocarditis, can actually make the inflammation worse. And two, we know that with exercise, with that intense inflammation, that could potentially be a risk factor for the precipitation of dangerous heart rhythms and potentially even sudden cardiac arrest or death. It is one of the more common causes of sudden cardiac death in athletes, despite the fact that it's not the most common condition out there in the general population.